All right, well, why don't we go ahead and jump in. Again, thank you for all those who are joining us today for our third Open Enrollment Town Hall hosted by the Department of Vermont Health Access. My name is Zach Goss. I'm a staff member at the department, and I'm joined today by Sean Sheehan, who's another staff member through the Department of Vermont Health Access. We're also joined by guest representatives from the insurance carriers, Blue Cross Blue Shield of Vermont, MVP Healthcare, and Northeast Delta Dental. And we'll have an opportunity to hear from them and ask them questions later in the presentation. So we have 7 days left until December 15th, which is the deadline to get a plan for that start through Vermont Health Connect through the department. That starts on January 1st of 2022. You'll hear us say that again later today. And there's lots of important things we want to talk about, and we're going to focus particularly on how to go about choosing a plan that works best for you or you and your family today. So just to kind of high level what we're going to go over today, we have an agenda here. We're going to go over open enrollment for 2022 and what's different for health insurance in 2022. How do you choose that right plan that fits your needs and your budget? We're going to do a plan comparison tool demonstration. So many of you have heard us talk about the plan comparison tool. You may have visited it on our website. It is really a robust resource that you can use to help determine costs and eligibility for, or estimate eligibility for financial help. And you can even access plan information from that tool directly. So Sean's going to walk you through that tool and talk about how to make some decisions around what plan might work for you. Our insurance company representatives are going to tell you some about their plans and plan selection within their particular company. And then, as usual, we want to make sure that we have plenty of time for question and answers at the end of the presentation. And speaking of question and answers, if you do want to interact with us, we welcome questions at any point during the presentation. If they seem like they're time sensitive to whatever's being presented at that point in time, we can raise them then, and I will flag those for the presenter. Alternatively, if it's something that would be better answered by the group at the end of the presentations, we will do it then. The way to write us a question is in the chat box. There's a question mark on your screen. You may have to find a drop-down menu towards the bottom of your screen, maybe on the top of your screen for some of you. And you can write right in that chat box and post your question there, and I will ask that to the presenter so they can answer it for you. So please don't hesitate. This is a great opportunity to ask specific questions to either myself or Sean or one of our carrier representatives. So I just want to start with some important open enrollment dates. As you know, many of you know, open enrollment, the time of year where a Vermonter can enroll in a health insurance plan or a qualified health plan through Vermont Health Connect, began on November 1st. So we are well underway. We're more than a month underway. And the next important date is the 15th, like we talked about before. I told you I would mention it again, and here we go. It's an important date because it is the last day to choose a plan with a January 1st start date. Now, what's a catch here is that it's not the last day of open enrollment. The last day of open enrollment is January 15th. But again, if you want to get that start date, meaning your coverage would begin on the 1st of January, you need to enroll by December 15th. So there is a deadline a week from today to enroll for that January 1st start date. And I'm going to tee this up for Sean just so he can dive a little bit more into detail, but not only for open enrollment specific, but just in terms of the kind of financial assistance you can get, there's a lot of changes this year to financial assistance. So there's a lot more opportunity for people to get significant financial help than they may have gotten in the past. So I'm going to let Sean jump into some of the big changes for this year and then navigate through the plan comparison tool where you'll see what those changes look like on the website. So Sean, feel free to take it away.
Thanks, Zach. Thanks, everyone. Great to be here. So we get our countdown toward that December 15th date, as Zach was saying, 7 days. Yeah, and as you see here, it's not a lot, not a big list of things that are different, just two, but they're really good news and they're great. We want to help get the word out to Vermonters because they're both significant. Number one is that I think we hear from people that say they don't have insurance because it costs too much. That's 97% of Vermonters have health insurance, 3% don't, but most of those who don't say the cost is the main reason they don't. And what we want them to do is come take a look at what plans will cost. Because of the American Rescue Plan Act, which passed this past spring, for vast majority of people, health insurance costs are much lower. The way that works is there used to be a threshold for tax credits of about $50,000 for an individual. That's more than double. So now you could be getting those lower costs if your income is up to $105,000, what you expect to earn in 2022. And if you're in a plan that both you and your spouse are looking to be covered, or you and a kid or kids, you could have an income up to $200,000 to $297,000, about $210,000 if it's just you and your spouse, $297,000 for if the whole family is getting covered. So, that's obviously the vast majority of Vermonters can get some help. So we want people to come look. Number two is one reason that people maybe were direct enrolled with insurance companies, and I should have started up forgetting that other point too. Under number one, to get these lower costs, you have to enroll through the marketplace. So if you're direct enrolled with Blue Cross or with MVP, you can transfer your plan over into the marketplace. You have to be signed up through the marketplace, through Vermont Health Connect, to get these lower costs. And one of the reasons that people maybe were direct enrolled was if they had problems with Vermont Health Connect in the past. And one of the frequent problems in early years had to do with billing, people having to mail their payments to Vermont Health Connect, having to get to the insurance company, those kind of extra steps along the way. Better to just deal with one entity, just deal with the insurance company. The good news is that starting in 2022, everybody is just going to pay their insurance company directly. So people who are already enrolled should be in the next week, probably by the middle of next week, you should receive your bill for January insurance, and it will come from Blue Cross or from MVP or from Northeast Delta Dental. And they'll tell you how to remit your payment, how to set up auto payment if you want, and a reminder to turn off auto payments to Vermont Health Connect once you've paid your 2021 bills in full. So to the extent that might be a reason people weren't signing up through Vermont Health Connect, thinking they'd rather not have that, rather get to keep paying their insurance company, even if it meant having to pay the higher costs, not getting the subsidies. We're happy to report for 2022, because of these two things that are different, you can have your cake and eat it too. I'm happy to take questions on that, but we can flip to the next slide for now, Zach. So the question then, where we're going to focus most of the time today, on how do I choose the right plan? Well, Northeast Delta Dental will talk about the dental plans, a little bit easier. And on that side, there isn't the flood of choice, but on the health plan side, it can seem overwhelming. When you look, for most people, you'll see you have 26 options. If you're under 30, you have the catastrophic options too, so you have 28 options, and knowing where to start can be really hard. I find it's helpful to break it down, really the decision into three areas. Number one, which insurance company, Blue Cross and and MVP. So for some, and these aren't in any particular order. You know, maybe you had a great experience. You've loved being insured by your insurance company. You want to stay with them. You know, deal with that question first. Check that one off. And that helps narrow down your choice. Maybe you haven't, and you want to tackle the meta level or plan design question first. But both Blue Cross and MVP will talk about the insurance company and talk about the plan design some. The meta level is there's 4 different meta levels you'll see. There's bronze, silver, gold, platinum. We'll show you those on the plan comparison tool. One really important piece to emphasize is there's not a difference in what services are covered. The same essential health benefits, things like inpatient care, the drugs, the physical therapy, mental health, all of those items are covered in bronze, just the same as platinum. The difference is whether you're going to pay a higher premium or lower out-of-pocket cost, which is the case with bronze plans, or whether you'd have a lower premium, that lower monthly bill, and higher out-of-pocket costs. That being the case with bronze. If I flipped it around the other way, apologies. It's the lower premiums and higher out-of-pocket costs with the bronze plans, and the higher premiums, lower out-of-pocket costs generally with the platinum, with a couple pieces we'll show in. And then the issuers, I won't talk about it here. We'll see a little bit on the plan comparison tool. The issuers will talk too about the difference between standard plans and the non-standard plans, standard being the state specified plan designs, non-standard being Blue Cross has put together their plan designs of select and preferred plans. They'll talk about them. MVP has their plus plans. They'll talk about them, and then the difference between a standard deductible and a high deductible health plan or consumer directed health plan. We can, I guess I was going to say we can flip, but actually I was going to take everyone on the tour here. If you go to a browser, I'll show you going to my browser here, and you can always do the same. If you haven't checked out the Vermont Health Connect website, I highly encourage folks to do so. Zach, I assume everyone can see that. If not, yell at me. This is our website. Go up to a browser. Go to a browser. You type in vermonthealthconnect.gov. You'll come to here. You'll have this extra message calling attention to the plan comparison tool to make sure you can't miss it. Normally, you'd come down here, you'd click on the plan comparison tool. It has a picture of a shopping cart, have a little bit of an explanation there. And if for some reason you wanted to look at 2021 or 2020, you could, but we're going to be looking at 2022 because it's 3 weeks away, and that's our focus here. If you want a little bit more on a video kind of explanation of the tool, you can click play over here. You can read more information, or you can fly right through it, as I imagine most people do. You can put in some information. So say I'm 30 years old. I'm not, wish I still was. Your spouse is 32. We have twins who are 5. Ask if you want to help finding coverage. Yes, please. The number of people in the household, that'll automatically populate it at the first 4. It's not necessarily the same though. You could imagine a situation where I might have a child from a previous relationship, and they get their health insurance from my ex, but I claim them on my taxes. So down here, you're putting how many people are on your taxes. If you're married, you do have to file jointly to get financial help. You don't have to worry. No worries if you didn't file jointly in the past. This is all 2022, so these are the taxes you'll be filing in early 2023. You want to say if you're offered employer-sponsored insurance. We're not. So then you ask what your household income is expected to be. Now this, for most people, is going to be the same as their adjusted gross income on their taxes. Obviously, don't know exactly, don't have a crystal ball, don't know what you'll be earning in 2022, but that's okay. You can report changes later in the year as you have them. Let's say we expect our adjusted gross income in 2022 to be $50,000. You'll get a screen here that's going to say the premium subsidy. So this is $1,496. This is much more than it was before the American Rescue Plan. And it means of any family, of any plan we can buy, we're going to be able to deduct $1,500 per month from the cost of that plan. You also see here it says this is coverage for just the person 1 and person 2, the 2 spouses. You wonder, well, what about the kids? So it says right here the kids actually qualify for Dr. Dinosaur, which is the Vermont's Medicaid program for children and pregnant people. And so there's a more generous threshold for kids than for adults. So the kids will get that Medicaid coverage, that Dr. Dinosaur, and I'll just be looking for a plan for myself and my spouse. Now, one really important note when you put in whatever your income is, if you see Silver 87 or Silver 94 here, back to our question of choosing metal level, you can check off that metal level box too, because if you see Silver 87 and Silver 94, you don't want a bronze plan because you're going to be able to get a silver plan for close to zero. Maybe you'll find these plans that are likely $0. And you're going to have an extra form of financial help, which is lower deductibles, lower maximum out of pocket, which are actually lower than gold plans are, and meaning that your total cost for the year is going to be guaranteed to be lowest if you choose a silver, and that's only if it shows Silver 87 or Silver 94. One way to change up here is say our income was a bit higher. Say we were earning $75,000, expect to earn $75,000. You would see here our subsidy would still be getting over $1,200 per month off of any couple plan we choose, but we now qualify for Silver 73. And what that means is it is a subsidy if we choose a silver plan, but we're not going to necessarily want to lock on to silver, because if it's not Silver 87 or 94, there's a possibility gold or bronze or platinum might make more sense, because we're not going to be able to get a silver plan for $0. And if we have a lot of medical expenses, we may be better off in a gold or platinum plan. To dial in here, if we click continue, we can go at, let's say we are folks who we've had Blue Cross a long time. We've had a good experience with them. We know we want to stay with a Blue Cross plan. We filter on Blue Cross. That takes our choices down from 26 to 13. Still overwhelming, still a lot, right? Where we can see here, this is sorting by cost in an average year, but the premium, that amount we pay each month, could be as low as $0, and that's over here if we choose a bronze plan. And so if we're pretty healthy, as I said, we're 30 and 32 years old, this bronze plan, its monthly premium, gross premium without subsidies, is less than $1,260. We're getting a $1,260 subsidy. That means we can choose that plan, or actually, as you see, any of these bronze plans we're able to get for $0 a month. So if we're comfortable taking a little bit of risk, and we think we're going to be pretty healthy, as we can see, if people are of our age group, over a third of the time, we're going to have a good year where any out-of-pocket costs we have are going to be only $700, and there's a good chance we could have zero costs for the whole year. Or if we're somebody who's thinking, I don't want to get health insurance, I'm pretty healthy. If you're 75,000 and a family of 4 here, get it. You can get a zero premium plan, and much better to have that protection if you do get sick or have an accident than potentially have hundreds of thousands of dollars in bills. But let's say you wanted to get insurance and you don't want that risk of potentially having a bad year, because if you were to have that accident and get the hundreds of thousands of dollars in expenses, you could be paying up to $14,000 in out-of-pocket costs. This is for the household together, both you and your spouse. There's individual limits there. So you'd want to have a plan of what would happen in that worst case scenario. Again, much better than being uninsured, but more than you might want to take on. So some of the options here, you can change around and sort by this toggle of what would the costs in a bad year be. If you're somebody who's who is more conservative, wants that risk, you may want to get a gold plan. You can see there's some some gold plans that would, even in the worst case scenario, cost you less than $10,000. That being both your $380 net premium, and your out-of-pocket costs. You can dig in to, because say you are somebody that has health needs and you want to make sure that your doctor is there. You can click on view the plan's doctor, view on the drug list to see what drugs you have, to make sure they're covered, that those take you right to the Blue Cross site, show you what their doctor's network are. And say you're somebody that's had MVP, for years, and you've had a great experience with them. You can do the same thing. You can filter on MVP. You can look right to their plans. We're on the costs for a bad year. Same thing here. You can see MVP will have that gold plan, where even in that worst case scenario, your total out-of-pocket costs, both your premium, plus your out-of-pocket costs will be, will be lower than those bronze or silver plans in this instance, again, because they don't qualify for silver 87 or 94 because their income's a little too high. And if they want to go back to sorting in a good year or an average year, or want to go down and find a deductible, make sure they have only look at deductibles that are, under a $5,000 deductible for the, for the household there. You can go down and sort that way. That's going to knock out a lot of those bronze plans, and you'll see the gold and the silver, rise to the top there. Same thing. You can click on the silver plan. You can see some of the details, some of the statistics there of how likely you are based on all of the 32 and 30-year-old couples out there in the country, how healthy they are, how much they use medical services. So again, when we get to the question and answer, happy to take any of these questions, but I'm also happy to turn it over now to the insurance companies, and back to Zach, where we can find some of the other ways. Because really, I think if you have 5 minutes to put into looking for a plan, trying to decide which of those 26 plans is good for you, highly encourage you to spend it on the plan comparison tool. But when we're talking about something as important as health insurance and healthcare, that's such a big part of our state budget and so many of our household budgets, spending more time to dig in and talk to the insurance companies is really important too. So happy to pass it back to you, Zach.
Thanks, Sean. That was really helpful, and hopefully helpful for everyone attending to see how the plan comparison tool works. And as you probably noticed, you can spend a little or a lot of time with that tool. So to move forward, we're going to go to the carrier presentations. And before I go there, I do want to, for our carrier representatives, I want to flag a question that's come in from our audience that maybe you can address as you go through your presentation. I know that we want to get through all the presentations and then have enough time. So hopefully it won't take you too much time to touch on this as you go through, but I'll just read the question so that you can integrate into your presentation if appropriate. So the question is, which plans allow for telecommuting out of state, in parentheses, non-Vermont employees of Vermont-based companies to get health care and specialist visits in their other states? Availability of coverage out of network versus in-network, other states as in-network by arrangement. So I think the question, the high level of that question, is around those people who may be Vermont residents, but are interested or need to get some of their care in other states. Without further ado, I will move to our first presentation from MVP Healthcare, and we have Kristen here to present us some plan information from MVP Healthcare. So Kristen, why don't you go ahead and take it away, and we will advance your slides for you.
Hi, good afternoon. Thank you for joining us today. As Sean stated, I'm Kristen McDowell with MVP Healthcare. Okay, can we continue? So I'd like to begin with our 2022 plan highlights. New this year is virtual physical therapy and vision plans powered by iMed. We have brought back our health savings account maintenance fees being waived and added a $500 allowance for acupuncture on our non-standard plans. We also include up to $600 in well-being rewards on those non-standard options. Next, please. So standard versus non-standard. The short version of this is, as it was mentioned earlier, the state sets the standard options and the non-standard options are set by the carrier. That's where we get to exhibit our unique benchmark features, which we feel by member use will bring the most value to our plans. Next, please. So the difference in our portfolio is that there are 7 standard plans and 6 non-standard plans. And for those who unfortunately don't qualify for any of those tax credits, we also offer 4 reflective silver plans, which mirror both the standard and non-standard traditional silver plans. Next. So let's get into some of the unique benefits that are only available on our non-standard options. As I mentioned, we have a $500 acupuncture allowance, so you'll go to a provider of your choice that's licensed, and we'll reimburse you up to $500 for services. Next, please. We offer $600 in well-being rewards. So this is 3 buckets. The next slide, please. Of $200. So for completing activities like our personal health assessment and getting your annual biometric screening, you'll earn up to $200. We offer reimbursements for purchases such as fitness trackers, run walk fees, and gym memberships, and then tracking for your activities. So your daily steps that you take or checking into a gym for a workout. 250,000 steps per quarter will earn you $50 by the 4 quarters. That's $200, and you've just earned yourself at least $600 in well-being rewards. Next, please. So you can get reimbursed to do more. This will also fall under that well-being reward. You can buy fitness equipment, health monitoring devices such as Fitbits or Garmin's, or even a nice ergonomic office chair for those of you that are still working from home amidst the pandemic. Next slide, please. So in addition to our regular formulary, we also include a VBID formulary. These are mostly maintenance prescriptions, and they'll be available at either $1 or $3 for a month's supply. And we offer on some non-standard plans $0 generics up to age 10. So if your baby or small child has, maybe a fever or some type of viral infection or colds, we'll offer those generics at no cost to you. So you can feel safe about treating your baby without breaking your bank. Next plan. So the benefits that are available on all of the plans in Vermont include the option to add vision. New this year for 2022 is our vision plan powered by iMed. You can shop online retailers or even local eye doctors, and basically we offer 3 different vision plans. You'll get hardware as well as contacts all under your allowance, and you only need medical to add the vision to your options. Next, please. As far as that telemedicine question, we do offer GIA. Now, GIA will allow you 24 access to a telemedicine provider, whether it's urgent care, mental health, primary care, emergency room, nutrition, psychiatry, all from the palm of your hand or your tablet or computer. And that's available with our GIA app, and you can also find more information at startwithgia.com. We offer virtual physical therapy new this year. You can have a physical therapy appointment just as you would a telemedicine primary care visit. So say you wanted to schedule that over your lunch break, the choice is yours. No in-office appointments, and you'll be able to recover from any muscle or joint pain that you're experiencing with a live dedicated physical therapist. Next, please. So on the high deductible health plans, you will have to meet your deductible first. And this is just a reminder that the deductible would apply, but it would still be lower in cost because we do negotiate the rates on your behalf. Next, please. Now let's dig into our high deductible health plans. Is the high deductible plan right for you? So HDHPs have lower monthly premiums. However, they do have higher deductibles compared to our traditional copay plans. You will save in monthly premiums, and that can be used to be paying for your out-of-pocket costs if needed. And also you can add a health savings account to save on your qualified medical and pharmacy expenses. So preventative treatments are always covered in full. So that would be your annual physical, your screenings such as mammograms, prostate checkups, colonoscopies, but you would have to pay for your non-preventative costs like those sick visits before your deductible is met. Next slide, please. Our HSA setup and maintenance fees are waived for Vermonters. So if you do choose one of our QHDHPs, you can set up a HSA and won't have to worry about any monthly maintenance fees. This is an interest-bearing account which can be used to help pay for qualified out-of-pocket expenses, not only for yourself, but also your family members. And as long as it's in this type of account, you don't have to worry about losing the funds. They don't expire. Next, please. Our network includes 54,000 providers and 21,000 facilities in New York and Vermont. And in Vermont, we offer our Cigna Alliance. That provides you over 1 million doctors at your disposal across the country. This runs from Alaska to Florida, Maine to Hawaii. And you can always find a doctor at mvphealthcare.com/find a doctor. Next, please. You can find out more by giving you can find out more by giving my team a call. We are at 1-844-865-0250. I'm a part of the Small Business and Individual Service Unit, and we're here from 8:30 to 5 p.m. Monday through Friday. Or you can give us an email at sbiu@mvphealthcare.com. Take it away, Zach. Thank you.
Thanks, Kristen. I appreciate you sharing all that information. And now we are going to move to Blue Cross and Blue Shield of Vermont. And I believe Jordan is going to join us to talk about Blue Cross. Hey, take it away, Jordan.
All right, thanks, Zach. So my name is Jordan Benson. I'm a consultant here at Blue Cross Blue Shield of Vermont. So we'll just quickly talk about what plans that we offer for Vermonters. So some of the questions to prepare for plan selection. So when you contact Blue Cross Blue Shield of Vermont, these are the more frequent questions that will ask you to help guide your plan selection for your coverage for yourself and your family. Are you looking for a lower monthly premium or higher monthly premium with lower cost share responsibility? So essentially how the plans, the meta levels operate is that, bronze plans are going to be your lower monthly premiums, but they do result in having a higher deductibles, co-pays, out of pockets, compare all the way up to a gold where they are with the higher premium, but it does result in lower cost share. And then of course, if you qualify for subsidies such as the advanced premium tax credits, which are both at the federal and state level, and the cost share reductions, that does affect, what plan you may want to select, as Sean mentioned previously. So within all the plans that Blue Cross Blue Shield of Vermont we offer, they provide you the same coverage, the same access to providers, the same drug formulary. Ultimately, really the difference is how you like to pay for your care. So do you want co-pays for office visits? Do you want to pay towards a deductible and then be fully covered 100%? And we'll go into more detail about what plans, those certain cost shares applied to. With every plan, there's a maximum out-of-pocket limit. So if you are healthy, looking for catastrophic coverage only, all these plans that we offer provide you that sort of relief that if something catastrophic happened, you would only pay a certain amount towards the maximum out of pocket. Also, if you are a pharmacy user, you have prescribed medications, there are some plans, that may favor you one way or the other based on what type of medications. And then also with our high deductible health plans, also we refer them to as consumer directed health plans, CDHP policies. Are you looking to contribute towards a health savings account? If you are, that does limit you with certain plans that allow you to contribute. So we have 3 different types of plans. Our Vermont Preferred and our Vermont Select plans are also our plans that we have designed at Blue Cross Blue Shield Vermont. So they're referred to as those non-standard policies. Then we have the standard lineup that, as Sean mentioned, they are standardized with the state of Vermont. So we have to follow the same coverage for those type plans. So within all 13 plans that we offer, we have 2 different policy types. We have a stacked and an aggregate, and those policy types apply towards the deductible and out of pocket. If you're insured if you're looking for coverage just for yourself as an individual, the stacked and aggregate won't apply to you because you'll just having one deductible for yourself. However, if you have a spouse on the plan or you're looking for family coverage, when you're choosing a plan, a stacked and aggregate may work better for you and your family situation. So with a stacked policy, if you're on a family plan, there is an individual as well as a family deductible out-of-pocket limit. So your entire family accumulates towards the family deductible, but if only one member of your family has routine care or has something, needs a service throughout the year, they only have to pay towards their individual deductible. So they don't have to meet that shared family deductible. Unlike an aggregate policy, where if you're on a 2-person or family, the deductible automatically doubles from the individual amount, but your entire family is sharing one common deductible out of pocket. So in this example, on a Vermont Preferred Gold plan, if you're on a family policy, you would have a $3,100 family shared deductible. So if you're one person just uses care, they don't have that individual limit like the stack policy does. It all accumulates towards the family amount, which is the $3,100 in this example. So with our non-standard product under our Vermont Preferred, this is our most unique plan that we offer at Blue Cross Blue Shield Vermont. So we do provide members with a certain amount of visits at no cost with either a primary care or a mental health provider, substance abuse counselor, with our combined 369 doctor office visit. So those 369 visits are additional to your preventive care for all members. So again, preventive care with any of the plans allow routine office visits with a primary care at no cost under the Affordable Care Act preventive benefit. So the 369 would provide our members an additional amount of visits for primary care or mental health provider without having to meet that deductible. And the number of visits is based on the number of people enrolled on your plan. So if you're a single only, you would have 3 visits. If you are on a couple plan, that's 6 visits. And if you have a family of 3 or more, you have the total combined 9 visits. As well as with our Vermont Preferred plans, we provide no additional cost visits for select chronic care with chronic care specialists. So any member that's been diagnosed with diabetes or heart disease and enrolls on our Vermont Preferred product, you would have 3 visits per year per member with a qualified specialist at no cost to you. As well as on our Vermont Preferred products, our select wellness drugs, which are medications based on certain therapeutic categories such as antidepressants, asthma, COPD, cardiovascular heart disease meds, diabetes. The deductible is waived for those medications. So on day one, if it's generic, preferred brand, or non-preferred, there's just an applicable cost share, such as a copay or a percentage that you have to pay. You don't have to worry about meeting the full deductible first. So the next few slides are just a breakdown of how the plan, just more details about each plan. So again, with our Vermont Preferred, we have gold, silver, and bronze metal levels. As I mentioned, all the plans provide you the same benefits, the same access to providers. And with our plans, we do allow, with our Blue Cross Blue Shield Preferred network across the US, you have providers available to you all throughout the US without the Blue Cross Blue Shield network. So ultimately, really the difference between, the gold, silver, and bronze is just really, you can see the cost share differences between the deductible, copays, out-of-pocket limits. And then our Vermont Select plans are those high deductible health plans, CDHP policies, which are eligible for HSA accounts. So you do have, with these plans, you pay the deductible and out of pocket first, and then you're fully insured 100%. You don't have to worry about the co-insurance. After you reach the deductible, you have to pay a percentage. So it's more of a straightforward type plan. And then the standard plans, which again are standardized by the state of Vermont. If you're looking for a plan that you just want to know when seeing a provider, such as primary care, mental health, chiropractic or physical therapist, specialist, urgent care, the standard plans allow you to pay those copays upfront before meeting the deductible for most of the plans. So the standard plans do tend to be higher in monthly premiums, but you also have the lowest out-of-pocket exposure upfront before meeting the deductible on most plans. As well as on the standard plans, we do offer 2 CDHP plans. Unlike the Vermont Select, where the deductible and out-of-pocket are the same, with the standard, you have a lower deductible, then you pay a co-insurance, which is a percentage between what Blue Cross pays and what you as the member pays up to the out-of-pocket. So if you have any questions, we're here to help. You can call us, email us. For open enrollment, we are available Monday through Friday, 8 to 6 p.m., as well as we are available Saturdays from 9 to 12. So if you have any questions about the products that we offer, what is the best plan for you, certainly give us a call or even email us and we can assist you with the best plan selection. As Zach mentioned, for January 1 effective date, you have up through December 15th to apply. But open enrollment is extended through the 15th of January. For if you miss the December 15th, you have the option to enroll or make a plan change for February 1 coverage.
Thanks so much, Jordan. So a lot of information there between MVP with Kristen and Blue Cross and Blue Shield with Jordan. And just to kind of give a hint, these presentations are recorded and will be posted on our website. So if you feel like you want to go back and watch it again and look at the slides in closer detail and hear their cover of the descriptions, you can go back and do that. We'll try and get that posted on our website within the next 24 hours or so. So I do want to go to Northeast Delta Dental and hopefully still allow a little bit of time for question and answer. So hopefully we can, it's a little bit more straightforward with Northeast Delta Dental, given that there are fewer choices. So with that, I will send it over to Kathy and Debbie for the presentation that they have.
All right, great. Thank you, Zach. I appreciate you handing the program to us. Well, yes, we have one plan. Northeast Delta Dental offers a Vermont Health Connect pediatric high option dental plan for children under age 21 and adults. So we do have the plan that's there. I love the network question. This Delta Dental plan takes advantage of the preferred participation organization network of dentists. So in addition to these dentists being in Vermont, this network is throughout the country. So if you're a college student, goes to college in, Ohio, and they need to have a tooth pulled or wisdom teeth out or something like that, they're in a lot of pain. We can help direct you to a PPO dentist, a network dentist, where they are located to maximize their benefits and getting the dental treatment that they need. So we're open throughout the country. The Premier Network is also an option for our Vermonters. The difference with the Premier Network, though, is that the out-of-pocket maximum is not considered when you go to a Premier dentist. So in order to accumulate your dental coverage toward that out-of-pocket maximum, you have to see a PPO dentist. And just, give us a call. We'll help you find a dentist in your area so that you can make that transition. In 2022, the children benefits, the unlimited annual benefit limit is covered for procedures with a Delta Dental Preferred provider or the PPO dentist. Children have an out-of-pocket maximum of $375 per enrollee and $750 per family per treatment completed by that PPO network dentist. Adult enrollees have $1,500 for an annual year maximum, and the annual year is the calendar year, January 1st through December 31st, for all covered services, with a 6-month waiting period for major restorative treatment. All enrollees have a $50 plan year deductible that comes out also. We're really hoping that with the expanded financial guidelines through ARPA, that more Vermonters will have the ability to purchase the dental plan for themselves and their family members. So we hope that that brings us more Vermonters into our Northeast Delta dental plans. Non-part network dentist is not covered under these plans, so give us a call and we will actually help you find a network dentist in your area. So. Customer service is open. That's my group in customer service. Debbie Bears manages the eligibility folks who help to keep our Vermonters on their Vermont Health Connect dental plan. We're here Monday through Friday from 8 a.m. to 4:45 p.m. to answer your questions. Do you have any questions for us? I'm ready for that. Thank you.
Thanks so much. Really appreciate that presentation, and a little bit more straightforward, but hopefully between the 3 carrier presentations, folks were able to gain some information about their plan options. We do have another question, and I just want to reiterate that initial question about network coverage. It sounds like actually all 3 carriers did address that to some degree. So it sounds like if you have further questions about the details of how your plan might cover you out of state, it would be worth exploring that directly with the carriers unless they have anything they want to add. But before we get there, I will just put this question to Sean. I think the carriers may have voiced this over too, but the question was, what was the lower payment, higher deductible, bronze or silver? So maybe just kind of reviewing the different metal levels and how that corresponds to deductibles and payments. Sean, if you would.
Yeah, absolutely. Happy to take that on. In general, for people with with high incomes, too high to get financial help.
You at first.
Oh, sorry. Need that Delta Dental if we could go on mute. So for people with high income who don't get any subsidies, the lowest premiums and the highest out-of-pocket costs are going to be in the bronze plan, and the highest premiums and the lowest out-of-pocket costs are going to be in platinum plans. The exception to that rule is people whose income is under 200% of the federal poverty level. So for an individual, that's about $25,000 per family of 4. It would be a little over $50,000. If your income's in those categories, then there's an additional benefit called the cost sharing reduction, which gives you that enhanced silver plan, which allows the silver plan you buy to actually have a lower deductible and lower maximum out-of-pocket costs than either a gold or platinum would. So a silver plan is going to give you the lowest deductible out-of-pocket costs. And at the same time, those premium subsidies you're getting are going to allow you to find silver plans in many cases that are $0 per month. And for people right close to those income threshold, we'll still be able to find at least one silver plan that has a premium for under $10 a month. So you're getting basically a 0 premium plan and very low out-of-pocket costs if your income is at that level.
Thanks, Sean. I appreciate the explanation. And wondering if either of the carriers, any of the carriers, have anything additional about the network coverage. I also wanted to just throw out there that, you know, we in past town halls have covered a lot of the terminology and a lot of the specifics around financial assistance and how all that works. So if you're hearing some things today that you feel like you want to learn more about, you can certainly find it in writing on our website or always call us. But just to kind of do a service announcement that we have done some other town halls. So if you like this medium and you want to search for another situation where we had Sean and myself or the carriers talk about things more in detail, certain terminology in more detail, please check out our website there. But I will put it back just to see if anyone has any additional questions. I see we've got a number of attendees, so we've still got a handful of minutes left on our town hall. If there's, and we have time for more questions, don't hesitate to pop them in the chat. And then carriers, if you have anything you want to add, or Sean, if you have anything else you want to add to what's been discussed so far today, please don't hesitate.
Yeah, that sounds great. I'm happy to talk more, but I think, yeah, would either Blue Cross or MVP want to say anything more on that network question that Zach flagged? Yeah, so if it's another question.
Yeah, I'll just
go ahead,
I'll just make it. Yeah, I'll make a note about our network. So our network is an EPO product. So it does provide in-network coverage within Vermont as well as across the U.S. with the Blue Cross Blue Shield Preferred network. So if you're a small business owner, you have employees that are outside of Vermont, they do have access to the Blue Cross network in those states that they reside. Or if you're a Vermont Health Connect or Blue Cross Direct individual, you have that coverage if you are traveling or you spend, the winter months in Florida, for example. So our plans do give you that extensive Blue Cross Preferred network across the U.S., as previously mentioned before.
Thanks, Jordan. That's helpful. Okay. Well, I think without any other questions, we can probably close out our town hall for today. Again, this recording will be posted on our website. So if you would like to visit it at a later date or want to share it with friends, family, colleagues, please don't hesitate to do so. We certainly want to get this message out to everyone as much as we can. I'll say it once more, that December 15th deadline is the last day. December 15th is the last day to apply to get a plan starting January 1st, 2022. So we still have a week left to get things in order to apply, but the sooner the better. Things generally get busier around deadlines, so we can probably expect higher call volumes and longer wait times if you wait all the way to December 15th, but we will try our best. We will get you in if you're able to call or contact us by December 15th, and we'll try our best to do it very quickly. With that, I think, Sean, unless you have anything else, I will sign us off for today. Thanks everyone for joining.
Yeah, thanks, Zach. I'll just give a final word. I'll leave the
Go for it.
table. I think just as you said, Zach, with the those first two, we talked about this town hall really building upon the first two. So I think as a result, we skipped past a lot of those glossary word definitions that we would have given in a normal first time presentation. So I think just to echo what you said, Zach, was if anyone heard any terms or anything they aren't familiar with, you certainly could go back and watch one of those other events. The other place, I know both all three insurance companies gave their phone numbers and websites for people to find more help there. I'll also just reinforce that there's other ways to get help in addition to the website on Vermont Health Connect are the toll-free number 855-899-9600. It's open 8 to 5 throughout open enrollment. Certainly you can call with any questions there. As Zach said, if you wait till next week, the last few days before the 15th deadline on the 15th, will likely be some long waits. So calling this week would be advisable. There's also, you could set up appointments with an in-person assister who works in your county. Would encourage you to again make that call this week. No promises they can get you in before December 15th, but I'm sure they could before January 15th. Beyond that, unless there's any other questions that have popped up, Zach, that's all there is for me. I've really enjoyed doing this and appreciate all the work from the insurance companies and joining us today.
Thanks, Sean. No, I think that's it. Just looking, and doesn't look like any other questions are popping up. So I think we will call it quits for today. And thank you all again. We do have one more town hall event in early January, and keep your eyes peeled for that one on our social media and on our website. And until then, take care and happy holidays.